FASN thanks Otska America Pharmaceutical Inc. for support of this podcast.
Good afternoon. Welcome to the Kidney Week podcast. I am Ankur Shah, the host of today's podcast. I'm here with Dr. Nisha Bansal. I will let you introduce yourself and then I'll go next.
Hi, my name is Nisha Bansal. I'm a professor in the Division of Nephrology at the University of Washington in Seattle. I'm really delighted to be here today.
Thank you. My name was Ankur Shah. I'm an assistant professor of medicine at the Warren Alpert Medical School at Brown University and also excited to be here. So we'll start away with what are our key takeaways from Kidney Week this year?
Gosh, it's been an incredible meeting. I think being back after some time away, you really feel the excitement in the air. There's increased energy in terms of science, sharing clinical knowledge, and just reconnecting. I think that's been a really pervasive theme in my experience this week, is just the power of reconnection with colleagues, friends, collaborators, trainees, etc.
I couldn't agree more. As an early career physician, it's been really an incredible opportunity to meet so many people. I've been able to round out a Zoom box into a person, and it's really been great. And the nephrology community is incredibly welcoming. There are many people who have been able to develop collaboratorships over just Zoom, and it was really great to see people who have been able to do so much and who are willing to do so much and help an early career physician out and to be able to see them in person and connect.
Ankur, it's interesting because I'm a little bit further along in my career. However, I can't agree with you more. When I joined the nephrology community, I didn't realize what this would encompass. And I think the spirit of family in this community really is the theme of Kidney Week. And I've only grown to love it more. And as I've gone further along, it is about building new collaborations, but also connecting with mentees. The ability to connect with early career individuals from across the world and provide guidance and share any knowledge I've learned is also a really powerful tool at Kidney Week.
I totally agree. I kind of think of being a nephrologist like being from a small town where everyone knows each other, and going to Kidney Week is our reunion week. This is our time where people I know from across the world, we're all coming together, and we all have this one thing in common, which is that we really just want to eradicate kidney disease. We want to make life better for people living with kidney disease. And it's incredible to get 12,000 people who have one common goal together. And we have so much else different, but so much more in common. And it's really nice to bring everything together.
Gosh, absolutely. Even you and I, in this short time together, have found commonalities, which has been really fun.
Absolutely. We both have hailed at times from the great state of Rhode Island.
A great state it is.
So let me ask, what are some of your favorite presentations or moments or events from the week?
There's been so many. The one that's sticking in my head right now is actually a session I attended this morning. It was a debate session in honor of Dr. Jerry Yee. It was just a beautiful session. There was just very heartwarming and touching memories shared about Dr. Yee and his impact on people, on patients, other professionals, and other people in our community. And so the entire session was in his honor, and it was really lovely. And then the debate content that followed was exciting. That's all I can say. You really had these really amazing speakers just battling it out with some of the core topics we struggle with as clinicians. And after every argument that was presented, they had my vote. I was thinking, I'm going to go, this person has convinced me. Then the opponent would come on, and their argument was equally as persuasive. So it was just a really fun, engaging learning environment. It was terrific.
That's amazing. I'm definitely going to have to check that out in the virtual recording. One thing I love about nephrology is how much gray that we operate in. And there are some amazing people who are able to turn that gray into black and white. And it really is fun to go to those sessions where we're not sure what to do, but we're figuring it out together. Some of my memorable moments, there was a really great emphasis on home dialysis this year. That is my area of interest. I was able to see discussions on, and I think what I would say is that there was a transition. In years past, I've noticed a lot of the home dialysis sessions have been related to why we should do home dialysis. But I noticed a shift this year, and the theme has gone more from why to how. We've gone past this is important to how do we actually do this. And so there were talks on dialysis discontinuation, dialysis transitions. The oral abstract session yesterday for the home dialysis abstracts were excellent. it was really energized me. As I was walking out of there, I was just thinking, wow, there's so many cool things happening. I can't wait to see what's going to be next. I'm already looking forward to next year's.
And then, it's interesting you brought up that theme, because I do think that there's been more of a theme of implementation and getting things done this year, right? We're moving past, and this is, I've noticed a shift in terms of thinking about earlier stages of kidney disease. How can we prevent kidney disease? How can we identify it? How can we figure out how to get the right therapies to the right people to actually move away from just treating it, but preventing it as well? And so I think that's really exciting. I think we've seen a lot of innovation in the field, and it's reflected in the content of this year's meeting.
I couldn't agree more. We're in such an exciting time in nephrology. We've gone from RAS inhibition to RAS inhibition, SGLT2 inhibition, non-steroidal mineralocorticoid inhibition. We're adding in GLP-1 soon. If you are in the space of IgA nephropathy, you are looking at so many therapeutic options. And so we're moving both in concert in terms of, for these disease states, let's find new agents, but we have so much new that we can do. We have so much that we did not have long ago. It's really exciting to have so much coming, and then to also start to be able to shift that focus to, all right, we know this works, how do we get it into patients?
Absolutely. I don't know if you had a chance to go to the late-breaking clinical trial session, but that was, wow, that was an incredible session and brought so much hope in terms of new therapies. And the range of trials that were presented were far and wide, thinking about specific disease states such as FSGS and IgA, to a pragmatic trial about transplant. So the range of science that is happening is so broad and so forward-thinking.
It really is. It's exciting to be in this time when we're seeing early stage clinical trials, new therapeutics, new medications that I was not aware of before. And then we're moving into medications that we've heard about a few years ago and that we're seeing expanded indications and better, stronger and bigger benefits. And then moving to the implementation world. We are in an exciting space in kidney disease right now because we are moving on all cylinders. We're firing in the early phase, in the late phase, in the implementation. I think if there's one thing I would tell people, it's that the secret is nephrology is really exciting right now, and I just want more people to know that.
I know, and it's always humbling to come to Kidney Week too, because there's so much to learn. No matter what, you're going to walk away from this meeting learning so much more than you came in with, no matter where you are in your career. And I think that is really epitomizes nephrology. You're a lifelong learner, and we're seeing that at this meeting.
Absolutely, and there's some incredible educators out there. There are such complex topics. I'm just going to say the word complement. And then you see people who are able to break it down into digestible, understandable pieces. It's exciting because you can come away with an understanding of something that you never thought you were going to understand, because some of the speakers who are recruited are just phenomenal.
Absolutely. And one thing that I've challenged myself to do at every Kidney Week is to go outside my comfort zone. So of course I'm going to try to gravitate towards the topics that I study scientifically or of clinical interest, but things like complement, that's a hard topic for me and something that I could learn a lot about, right? There's a lot of growth opportunity professionally. And so every Kidney Week, I make it a point to attend those topics that are less comfortable so I can continue to grow from these experts.
I think I'm going to be borrowing that idea from you. That sounds like a great use of Kidney Week. Is not something that I have done a lot of yet. I'm still early in my career and early in my Kidney Week career. This is actually my second Kidney Week as a faculty member in person. Wow. I graduated in 2018, then something happened in 2019 that changed the world a little bit. And so it's really so exciting to be back in person. And I love that perspective of broadening your horizons. And it's great because there's so much happening at every level that you can learn from how they're moving their field forward to apply it to move your field forward at the same time as learning where their field ended up.
And I think that's something that people don't appreciate, is that there are opportunities to sub-specialize within nephrology because it is so vast, right? And so that's why we really do need to lean on these peer communities to keep us all up to date on what's happening. It's impossible to know it all otherwise.
Absolutely. I think when I first started seeing the late-breaking clinical trial sessions, actually 5 years ago, immediately I knew this is exploding. Our options are exploding. Our field is exploding. there is onconephrologist, GN specialist, home dialysis specialist, complex hypertension specialist, interventionalist. I could keep going. I don't want to bore the audience too much as I list off all the advanced training pathways, but there are so many places you can specialize in. There's so many places that you can make a career in. It really is. We kind of have an abundance of opportunity right now. And that's another thing that I don't know that people going to nephrology are hearing. When I was going to nephrology, I didn't know the amount of opportunity that was waiting for me on the other side. It was only once I became an early career faculty member that I said, there's so much here. Someone needed to tell me that a few years ago.
Yeah, and I can share a story. So I was on the fence about nephrology as a medical resident, and it was attending a kidney week that made that decision for me. It really changed my entire professional path. I saw the excitement, the opportunities, and the community that I hadn't seen in other fields. And I knew from that moment on that I wanted to be part of this.
I was actually in the exact same boat, and it was the Kidney Stars program that I was a Kidney Star as a second-year internal medicine resident, and it was coming here, it was getting the mentorship from a fellow, it was also seeing peers around the country who were also interested in nephrology, and it was just seeing the excitement. The excitement was so palpable. And I saw a poster that 50% of Kidney Stars graduates have gone into nephrology. It tells you the impact of that program, and I'm one of them.
I think we can say we're success stories of early exposure to Kidney Week.
Exactly. And so I think it's also really cool that the ASN has these innovative programs where they're putting their money where their mouth is. They're saying, we want people to get an early exposure. We're going to support them. And so the Kidney Stars program was really a game changer for me. So I think one of the highlights that we both definitely have talked about is that it's really great to get back with our community. So I'd love to hear some of the highlights of the people you've been able to see and what the ASN brought for you.
Yeah. Gosh, there's so much to say in terms of community building here. So one thing that's been fun for me is, as somebody who's moved around a lot to different institutions, is that I've been able to reconnect with my old mentors who continue to be lifelong mentors. That's the beauty of being in nephrology. But connect with my old mentors and then introduce them to my mentees and talk about multi-generational mentoring right there. It's been really wonderful.
I couldn't agree more. It's really been great. I did a lot of my training in the city of Philadelphia where we are right now. And so I was able to see people from my residency, people from my fellowship, people I haven't seen in 5 to 7 years, people who maybe are not as mobile, not able to get to other kidney weeks. And so the ASN brought us back together. And it was really nice to be able to see so many people who have helped shape me into who I am. And it was great to also be able to introduce those people to my current mentors. As an early career physician, I'm able to be the bottom rung of that multi-generational mentorship. And it's really nice to be able to bring my mentors to my mentors and say, thank you all for shaping me. And I really appreciate everything you've done. And then it's also been really great to start introducing our medical students and our residents. We have a medical student here who's in the Kidney Stars program. She had a phenomenal exposure to kidney disease. She even started going to some of the dialysis sessions. Wow. And so it's that multi-level mentoring that has been really nice to be able to see happen.
Can we just talk about the science as well? I mean, gosh, I've walked away from this kidney week with, I think, no joke, maybe 5 pages of Grant Ames written. It's just been, you've talked a lot about the Zoom meetings. After spending a year on Zoom meeting with potential collaborators, this is the moment that we got together and sat down and started sketching out science. And so my head is spinning with ideas right now.
Absolutely. The peritoneal dialysis and home dialysis community, this was for a lot of us our first time actually seeing each other in person. And we actually already have 2 collaborations and potentially a third that have spawned in just the last 2 days. There are emails flying around, names flying around, aims flying around, collaborations flying around. I'm really excited, not just for what we've seen, but like you said, for what's going to come from this.
Yeah, and this is really what team science is about, right? Science can only move forward when we're inclusive, and we include a range of ideas from all across the world, all across the country. And this is the form that those ideas come to fruition, to be honest, right? These in-person interactions.
Exactly. And I think that the same way that the clinical area of nephrology is delving into further more sub-niches, so is the research. An epidemiologist can be many different things right now. A health services researcher can be many different things right now. And I'm just thinking from the epi perspective. And so it's really great to meet people with similar interests but incredibly different approaches who can open up your mind. And having talked to, I will just name investigator Yuvaram Reddy. He's a qualitative researcher at the University of Pennsylvania. The suggestions he had were so eye-opening to me. It was really just great to be able to find collaborators and have people who can move you forward.
And do you find, I'm curious because this has been my experience, is that those in-person conversations, they're, a Zoom call can't replace that. There's some organic interactions, that collaborative spirit that can only happen in person.
I agree completely. I think a Zoom call is better than nothing, but I don't think a Zoom call ever can come close to what an in-person meeting can do. And I think this year has really shown that, at least to the home dialysis community, we have been connecting virtually over the last 3 years, and just seeing the connections that form today, the collaborations that form today, the research projects that are going to come out of today. There is going to be an explosion in that space, and I think that explosion is going to be entirely due to the fact that we were able to get together in person.
Yeah, I had a really fun experience where I was sitting in a talk next to somebody that we had talked about collaborating for some time. And during the talk, the ideas started swimming in our head, and we pulled out pieces of paper and started sketching out ideas. And literally by the end of the session, we were ready to go. We have meetings set up, ready to move science forward, and it was just incredible.
That's what this is about. Yeah. This is not just about the advances that have gotten us to today. We're excited for the advances that are going to be at Kidney Week 2024 and Kidney Week 2025. And it is those collaborations that form in these rooms at Kidney Week that will start that.
What are you looking forward to most about next year's meeting?
I'm looking forward to, you know what? I don't even know what I'm looking forward to, because when I went to the late-breaking clinical trials this year, it was amazing. I didn't even know where we were seeing progress being made. There is progress being made in so many different areas. I'm looking forward to just seeing where the nephrology community progresses to over the next year. How about you?
Yeah, I think what I saw was a lot of early stage clinical trials this year. So I'm hoping that that work continues and these trials get into stage 3, stage 4 trials where we can study interventions on a larger level than we have to date. So I think this year's meeting has really set the stage for that subsequent work. So hopefully we'll see more to come next year.
I couldn't agree more. We have an exciting future ahead of us. We have an exciting present, and there's been a lot of work that was done in the past to get us here. So we've got a lot coming. Well, thank you so much for joining. It's been a pleasure doing this. Enjoy the rest of your Kidney Week.
Thank you so much.
FASN thanks Otsuka America Pharmaceutical Inc. for support of this podcast.